Every 3 seconds, someone in the world develops Alzheimer's, a disease that slowly erases memories, independence, and identity. But here's the question more and more people are asking. Can it be reversed? Or is it always a one-way path? If someone you love is affected, or if you're just trying to understand what's really going on inside the brain, this video is for you. So stick around because this will make you look at Alzheimer's in a whole new light. So let's get into it. Number 1, what is Alzheimer's? You might hear of Alzheimer's disease and simply think of forgetfulness. However, that's not all it is. Alzheimer's disease is a condition where your brain becomes victim to cell damage, leading to loss of certain functions of the brain, which includes memory along with other abilities. And it's much more common than you might think, approximately affecting 24 million people worldwide. And if we look at the stats closer, 1 in 10 people above the age of 65 and 1 in 3 above the age of 85 are victims of Alzheimer's disease. You might be wondering, how is the decline of gray matter linked and why is it important? Well, in simple terms, your gray matter, which is a type of brain tissue, contains the majority of your brain's neuronal cell bodies, and it helps play a major role in processing and controlling functions such as memory, movement, learning, and emotions. When someone gets Alzheimer's, their brain basically starts shrinking because their gray matter volume declines. Why? Because all those neurons and brain cells that are getting damaged are essentially dying off. The more this happens, the smaller your gray matter gets. And that's why memory and other cognitive functions such as focus and decision-making begin to get fuzzy, and individuals can't think as clearly anymore. As Alzheimer's keeps progressing, those regions in your brain that process and control memory, think temporal lobes, hippocampus, and cingulate cortex, take the biggest hits. There's no wonder why people start having trouble remembering stuff or even recognizing people they've known forever. It's not just about forgetting where you parked the car. Sometimes you forget you even have a car. So what's actually going on inside the brain? And how does this terrifying disease spread? Well, here's the deal. Alzheimer's doesn't just pop up randomly all over the brain. Instead, it follows a pattern. Usually it starts in the hippocampus and amygdala, the memory and emotions region. That's why memory and emotions get hindered first. Then it targets the frontal and parietal lobes, which are in charge of functions like making decisions, planning, and keeping you focused. So one by one, the disease targets and damages the healthy brain cells. And the damage to the brain tissue and cells all begins with a buildup of a sticky protein which is known as amyloid beta, along with twisted proteins inside the neurons known as tau tangles. This buildup amplifies the nerve cells in the brain, which, as we talked about earlier, leads to a decline in gray matter. Number 2, the stages of Alzheimer's. As we talked about earlier, this disease is a progressive one, meaning it worsens with time. And even though it follows a predictable pattern, it may show differently for each person. To classify, Alzheimer's can be classified under 3 main stages of symptoms. The first stage is the preclinical stage. In this stage, the Alzheimer's has already targeted the brain and changes in the brain have begun. However, the signs of the disease will show up later. What's scary is that this stage may even last for years. Then comes the mild early stage. In this stage, some signs show up, such as mild forgetfulness. But this is tricky, as this symptom is also normally seen as a common sign of aging. Other signs of this stage also include issues with focus and concentration. So during this stage, an individual may even live independently, but slight problems in their daily routine will start to appear. Problems such as managing money, staying organized, recalling recent events and names, and so on. After this stage, the disease progresses to the moderate middle stage. This is typically the longest stage, usually lasting many years. And in this stage, the problems become more apparent and hinder normal daily activities. So issues in learning, remembering, and even issues with reading, writing, and working with numbers emerge. And as the disease continues, the person may even have a major personality change and suffer paranoia or delusions. This disease can also take a massive toll on a person's emotional and mental health as well, making them more anxious or agitated even. Then comes the most severe and late stage. At this stage, severe issues that can become harmful for the patient occur, such as the loss of physical ability like walking, issues with speaking, loss of bladder control, and unawareness of surroundings. Now, when it comes to diagnosis, doctors usually take an interview of the individual using multiple types of tests to try and see how well the person's brain is functioning. basically using memory tests in various forms like puzzles and more. But this is more of an initial test. If needed, other more in-depth tests are conducted like CT or MRI scans that can show the brain's imaging. Only after a successful diagnosis and understanding of the stage of Alzheimer's, the doctor can give the patient the appropriate treatment. Number 3. Can it be reversed? Researchers continue to study new drugs and treatments that could actually cure Alzheimer's and reverse its effects. But till now, there's no set cure. And while there's no cure yet, that doesn't mean there's no hope. The symptoms can still be managed to a certain extent, and with the right mix of treatment available, the effects can be tamed. So let's dive into what treatment methods already exist. Alzheimer medications. To set the record straight, the present medication we have will not be able to stop the disease from progressing, but what it will do is ease the effects. So effects like confusion, memory loss, and difficulty with decisions and focus can be improved. Doctors usually start their patients on a medication called an ACHE inhibitor, which stands for acetylcholinesterase. The reasoning behind using this particular type of medication is that these meds help the brain boost acetylcholine. Acetylcholine is basically a chemical that helps different regions of the brain communicate with each other. Why is this important? Well, like we said earlier, Alzheimer's targets the brain in a pattern which follows its communication pathway, so people with Alzheimer's have their communication pathways damaged. This explains why these meds can help fill in the gaps and boost communication with the brain, especially in the earlier stages. Meds like donepezil, galantamine, and rivastigmine are usually the go-to. Speaking of that, these medications do come with their own side effects, such as nausea or loss of appetite. However, it is reported that these effects go away after a week or two. If those meds don't work or aren't well tolerated, doctors might turn to memantine. This one works a bit differently. Instead of boosting acetylcholine, it balances another brain chemical called glutamate, which in excess can actually hurt brain cells. Memantine is usually prescribed during the moderate to more severe stages, and yes, it also has some common side effects like dizziness or constipation, but nothing long-term. Behavioral changes. Now, with time, the effects and toll of Alzheimer's only increase, and then it's not only the memory that's affected, but also the person's behavior. So people affected by Alzheimer's also tend to display signs of increased anxiety, frustration, or even aggression. This happens because of the changes in the brain, but it's also understandable why these emotional changes may occur if you can imagine the feelings of the person suffering from Alzheimer's. You might have heard some stories of patients wandering off and don't even know where they are, so imagine the feelings of anxiety and restlessness they must experience. All in all, this disease is one of the most terrifying ones, as it eats one up quite literally if you see the brain before and after. And no one willingly wants to turn to medication and be dependent on them, but in some cases it seems to be necessary. Additionally, in the severe stages of Alzheimer's, where the person may even suffer from delusions and hallucinations, they might be given an antipsychotic like risperidone, but in small doses for a limited time, as long-term use can be very harmful. If it looks like depression's playing a part here, the doctor might bring up antidepressants as an option. And sometimes, to be honest, they'll suggest medications that aren't technically approved by the FDA for Alzheimer's. These are what they call off-label uses. It sounds a little unusual, but it's actually pretty routine these days. But it is important that the doctor explain exactly why they're recommending that approach so you're not left in the dark. Therapy and support. Living with Alzheimer's is already very complicated and tough, and while medication does help work through its effects, that's only one part of it. The other side is the emotional support. With emotional support, therapy, familiar routines, and stimulating activities, the quality of life for an Alzheimer's patient can be greatly improved. Those things can really lift someone's spirits and help them find more enjoyment in daily life, even as challenges come up. Cognitive stimulation therapy is one example. It's basically small group sessions where folks do puzzles, games, or memory activities. It keeps the mind active and keeps the spirits up. Then there's cognitive rehabilitation. Cognitive rehabilitation is sort of like physical therapy, but for your mind. How it works is that a specialist sits with the person and finds small, realistic goals for them to achieve. And by small, realistic goals, we mean something as simple as practicing how to use the phone again or how to move around their home more confidently. Because what may be small for us may be a great task for them. Now comes reminiscence therapy. This therapy style focuses more on helping the person reminisce about their life. How? It can be as simple as going through old family picture albums, putting on some music from back in the day, or even just sitting with close family and friends and talking about past memories and experiences. This helps because for many, even when some things begin to fade and become hazy, long-term memories hold on, and tapping into those can be a source of comfort. There's also something called life story work, which is basically putting together a scrapbook with photos, keepsakes, and personal notes. For caregivers, it's a window into what matters most to the person, and for someone living with Alzheimer's, it helps keep their sense of self alive and well. So there you have it. Alzheimer's isn't just some forgetfulness. It's this slow, terrifying unraveling that messes with way more than just memory. Suddenly, stuff like making a cup of tea or even following a conversation can get challenging. But the point of this video wasn't to scare you. It was to inform you and hopefully give you a little peace of mind knowing that there are ways to manage the disease. Sure, there's no cure yet. That part's tough. But we're not totally helpless. Like we just mentioned, that even though the meds aren't meant to cure the disease, they do ease some symptoms. And the sooner you understand what's going on, the more you can actually do about it. Oh, and if you think someone else needs to hear this, make sure to share it with them. And let us know in the comments below what more you want to know. We'll be sure to look into it.